Last year, what we did with this session is kind of talked about avoidable, unavoidable pressure ulcers. We talked about some other aspects. So we got a lot of feedback, as one can probably imagine when having this subject matter. And so we decided to go a little bit further with the subject this year. And I'm going to turn this podium over to one of the attorneys.
What we've done, what Steve has done with his staff, is he's come up with just a simple sort of case involving a 77-year-old female who has a stroke and ends up in a nursing home and has all sorts of comorbid issues and eventually develops pressure ulcers and lots of problems and then dies. And now there's a lawsuit. And poor Dr. Altman, who is our guinea pig today, is on the hot seat. So we're going to try and simulate here a deposition. Steve will depose him. I will then try and rehabilitate him. And then following the presentation, we'll take your questions and we'll try and sort of dissect whatever happens here. And hopefully, those of you that have been in a deposition will give us some of your input, insights. And if you've not been in a deposition, he's never been in a deposition, so he's nervous. That's part of it. That's part of the process, and so that's part of what we'd like for you to see. And then we can deal with it and give you some insight. Okay? Ready?
We're ready.
Kind of.
So I'll dispense, in the interest of time, I'll get right to the point. Dr. Altman, you do understand you're under oath here, correct?
Yes.
And between May 24th and October 31, you were responsible for a patient named Miss Jones, were you not?
Yes.
And she was a resident of a nursing home, is that correct?
Correct.
And when she entered that nursing home on May 24th, she had no skin alteration of any kind anywhere on her body. Is that correct?
That is correct.
And when she left that nursing home on October 14th, she had at least 2 stage 4 pressure ulcers, one on her sacrum and one on her left hip. Is that correct?
Yes. Yes.
And she was septic. Is that correct?
Yes.
And she had osteomyelitis. Is that correct?
Correct.
And actually 2 weeks later, she died, in part because of the sepsis stemming from her infected stage 4 decubitus ulcers. Is that correct, doctor?
Objection as to the form of the question, also as to foundation. You may answer the question, doctor.
She did die, yes.
And she died for the causes that I just suggested. Did she not, doctor?
Objection as to foundation. You may answer the question, doctor.
That I'm not sure about.
Oh, so you didn't follow this patient when she went to the hospital, did you?
Objection as to the form of the question. Argumentative.
This is how a defense lawyer can get their witness in trouble. When treating a patient who is at risk for pressure ulcers, it is very important to assess that patient's risk factor, correct?
Yes.
And once you make that assessment, then you need to develop a plan, correct?
True.
And then you have to make sure that the people that you're working with implement that plan, correct?
Correct.
And if the bad things happen despite an appropriate assessment, plan, and implementation, then you need to reevaluate what happened, correct?
Yes.
And there is this concept of unavoidability in pressure ulcers, correct?
Yes.
And would you agree, doctor, that you're really not in a position to maintain that a wound was unavoidable until you've assessed, planned, implemented, evaluated, and communicated?
True.
Thank you.
Doctor, in a patient, can you always prevent the development of pressure ulcers?
Can the patient prevent?
No, can you? Even under the best of care, will some patients develop pressure ulcers?
No, it's sometimes absolutely not possible to prevent.
Okay, and once a pressure ulcer has developed in a certain patient, is it always possible to prevent its worsening?
No.
What's a chart, by the way? Medical chart.
It's the document where clinical notes are documented.
You write in it, yes?
Yes, I do.
Objection,
Right.
not in this chart.
Not in this chart, correct.
Nurses write in it, yes?
Yes.
APN,
Correct.
PCP,
Yes.
and others, yes?
Yes.
Is that a form of communication?
Correct.
Was there a chart at this nursing home regarding this patient?
Yes.
The APN, every time that you in the APN speak regarding a patient, do you always do that in writing?
Yes.
Always.
Always do it in writing, yes.
You always do your communication in writing? You never speak on the phone?
We speak on the phone between two of us, yes.
Okay, so
But-
besides the chart, you also communicate verbally, correct?
Yes,
That may also happen with nursing home staff that may give you a call from time to time?
yes,
Not always is that reflected in the chart, true?
true.
Is the APN employed by you?
No,
Is the nursing home staff employed by you?
no,
Are you responsible for the PCP?
no.
You didn't see the patient. Why didn't you see this patient during this admission?
We work with the APN collaboratively, and on certain occasions, when the wound is easy to manage, APN treats it independently without communicating with me.
Do you actually do the skin assessments and plan of care regarding risk for developing skin ulcerations in the chart?
Do I personally do it?
Correct.
If I see a patient, I do.
Okay, but usually who does the skin assessments?
Usually it's done by the nursing staff at the time of the admission.
In other words, you do not.
Correct.
Doctor, did you comply with the standard of care in your care and treatment of Ms. Jones?
Yes,
Did you cause her death?
I did not.
Thank you.